Oh, hello. I didn't see you there. I'm Stacy. I'm a student physical therapist at Adventist University, and I'm going to be going over short-term positioning in sidelying and sitting. When considering short-term positioning, you want to take in the person, the task, and the environment. You also want to consider the patient's safety, comfort, and accessibility. Make sure their spine is in a neutral position and protecting that greater trochanter by moving the hips anteriorly or posteriorly. So a typical spine curve is maintained by having a pillow under the patient's head and also a towel under the patient's waist. So by doing so, it allows the spine to be in one straight line. So come on over and check it out. So here we have Miss Stephanie with the pillow under her head, the towel under her waist, and her spine is in the even line. All right, so now comfort and stability are maintained not only with the pillow under the head, but we're also going to put a pillow in between Stephanie's knee. So the ankle is protected now too. And for the uppermost arm, we want to stabilize that. So we're just going to give her a pillow to hold. How does that feel, Miss Stephanie?
Great.
All right. Okay, so a review for short-term positioning and sidelying. Remember, we're going to have the patient's spine be in a neutral position. We're going to have that pillow under her head, a pillow in between her knees and her ankles, and a pillow for her uppermost arm to rest on. Also, remember, we put that towel under her hip to keep that neutral spine. Is that comfortable, Steph?
Yes.
All right. Some additional takeaways from this is before the patient even gets in the room, make sure everything is clean. Wipe down your table before and after each patient. Make sure the linen is cleaned appropriately. Make sure you wash your hands and that it's visible when they walk in. Also, approach a patient appropriately and don't use nicknames. Stephanie, how's it going? Happy Monday. All right, so I'm gonna get you into a sidelying position, okay?
Okay.
So go ahead and lie on your side. Oh, crap. I'm sure it's clean. Just
What?
there we go. They clean like once a day, so it's fine. All right, so how's that feel right now?
Not good.
All right, go ahead and shove this under your hips. Oh,
No.
there we go. Make sure your spine's like straight and all, you know. All right, go ahead and hold on to that. There you go. And also, let's put this right here. All right, lift up. All right. Good?
No.
All right, so you look good. I'm gonna see you later, okay? I'll have someone come in and check on you. Guys, so now we're gonna go over short-term positioning while sitting. A couple of key factors that you wanna take in consideration is you don't wanna have the patient sacral sitting, you wanna have support under their back. Also, you wanna protect their distal thighs if their legs are too long for the chair. So you wanna have some kind of support under the feet, whether it's a stool or foot casters. And also you wanna make sure that the armrests aren't too high up. You want it to be a nice relaxed position. So now we're going to review short-term positioning and sitting. So the first step that we want to do is make sure the patient's hips are fully back into the chair and that they're centered appropriately. So Stephanie, can you go ahead and squeeze your hips further back into the chair? Good. Now I'm going to put a towel, or you can even use some kind of bolster to put in the low of their back to keep a neutral spine. So go ahead and lean forward. Good. So I'm going to put it right in the center of her low back. Go ahead and lean back. You feel that support? Does that feel okay? All right. So the second step to look at when you're doing short-term positioning and sitting is the hips being flexed. So right now it's a good angle because her back is supported and her distal thighs are supported too. But in the instance that you don't have leg rest, so let's take these out. You can either use a stool or some kind of bolster to put under the feet so it's not straining on those hip flexors and the low back. So right now I'm going to put this bolster under Stephanie's legs. Let me put a little closer. Good. Does that feel okay?
Mm-hmm.
All right. All right, so the third thing you should look at while doing short-term positioning while sitting is the height of the armrest. So Stephanie, go ahead and put your arms on the armrest. You want the shoulders to be comfortable and at the right height. Does that feel okay? Good. Now in the instance that you don't have armrest, all right, so once you get the armrest off, or in the case where you don't have them, you can even use pillows to put under the patient's forearms. So put down. Good. Does that feel okay? All right. So oftentimes some therapy situations call for an examination or intervention to be done. So while doing this with short-term sitting, what you can do is place some cushion behind the patient's back, and also you're going to ask them to lean forward. So by having the two pillows here, you're going to offer support for the head and the forearms. And lean forward with your arms there and your head. Good. So to reiterate everything that we talked about, when a patient is short-term positioned for either sitting or sidelying, make sure they are safe, accessible, and comfortable.